Next up, we have Rachel Kerr, a speech pathologist located here within the Royal Children's Hospital. Rachel has seen quite a number of children impacted by neurofibromatosis in her work with the ENT department. Fantastic. Now, I do have your slides loaded.
Okay. I guess first of all, I would like to just explain that my work area is typically I'm interested in neurology, and that's where I've come from for many years working here at the Children's Hospital. But I've also been working with the cleft VPI and airways kind of management as well. So somehow the two married up with neurofibromatosis, and I have developed an interest in talking quite a bit with Gabby, one of the neurologists here, about the children that he's been seeing and having a few more questions about what it is that we can do, and even having a look more at assessing, because it's something we're not typically involved in the clinic at this point in time, but we'll see what happens in the future. So I guess taking it down a notch from all the fantastic research that has been going on and from the fantastic talk this morning too from Professor Korf, we're going down to a bit more ground level about communication itself and things that can impact on communication. Communication is not just about speech or language or voice or fluency or pragmatics being the social use of the words that we use. It's not even just about that. We have lots of different reasons for communicating and lots of different things that are involved in communication. And all of these things can actually be impacted by some of the things that we've talked about already today, from the neuropsychology profiles of some children that we see, but also just typical development as well. I use a Mac, I apologise. My slides are not matching up as well as they could do. So we do communicate for lots of different reasons, and we do need to do a lot with our communication to be able to get along in our world. There are things that can impact on communication in a typical population are things like developmental difficulties that can come from a number of different causes. Even having just the opportunity to communicate is really important. And that can be impacted by things like extended hospitalisation, extended periods of illness and not feeling particularly well in the early years, and having the access to people around you to communicate with. A child's temperament alone, which is something that comes with them and may have nothing to do with their NF or any other diagnoses, but the temperament alone too can explain some of the reasons why they're having some difficulties in communicating, or even just for everybody. Things that can impact on communication are speech and language delay, or even just a social communication delay or disorder. And that's some of the things that we've talked about with the higher rates noticed with ASD in this population. But some of the other things that we've noticed with NF, particularly with the kids that I've seen just through the clinic work so far, and in looking at some of the literature, which is a bit sparse, is about some of the muscle movement and strength. So we know that there's quite a high proportion of children have low tone, and that's something that's more global. It's not specific to muscles on their own, but it certainly can impact on your speech clarity just on its own. So if you don't have good postural control, or if the muscles themselves aren't working as well as they could be, then you're going to have impacts on the smaller muscles in the mouth when you're trying to communicate. And we notice even things like breath support, if that's not particularly strong, that's going to have an effect on how well you can communicate and be understood. So looking at just the structural aspects, the mouth structures might be affected by neurofibromas, and we can also have the nerves that are affected for speech and swallowing. So we, as speech pathologists, we actually also assist people with swallowing difficulties, and sometimes in the early years that can be something that comes up as a concern. And we've talked a little bit about executive function and learning and behaviour, which also impacts on communication. So whilst it impacts on how well you go with your learning environment at school and academic performance, all of these things can really impact on how well you go socially at school and even in the earlier years. We don't always know everything about just yet. If people are interested, the Speech Pathology Australia website has some really good communication resources just about milestones for the early years and understanding what is typical development. Sometimes it can be really hard to look at what the specific factors are that you're looking for, say with NF versus typical development, and what's the difference, because there are lots of things that can come up in the early years that the general population might experience, and things that can come and go. So a speech delay that might improve on its own or with some support from a speech pathologist, but then there might be some longer and more difficult challenges coming ahead with their development as they get older as well. So I've just put up a little slide here about the expected sounds and the order that they come around, because sometimes that can be a typical question that we get, is what's standard speech errors for certain ages. If there are concerns with communication, we're not involved in the clinic here, but particularly for people who are further out from Melbourne as well, then in the first instance discussing it with a GP or paediatrician, and they probably hopefully will refer you directly to a local speech pathologist, which would be a really good starting point. Having just a thought about what might be the factors involved in their communication difficulties, and that would be discussed with a speechy, probably primarily. The local speech pathology, I'm really pleased to see that there's someone talking about NDIS today, because that would be hopefully a really good avenue for some people to be getting some support. But there are also community health centres that see children up to the age of school, and private therapy that there's some avenues where you can get some extra help through your GP if you have a discussion with them about accessing private therapy. Put a little one in here, especially after what we've just heard. Checking hearing in the first instance is really good if you're considering seeing a speech pathologist, because sometimes that is actually the first place that needs to be managed before we could get involved in assisting. So having a look a little bit at the research, when I was trying to do my rudimentary literature reviews, it came out that there wasn't a whole lot out there about NF and speech difficulties. And sometimes it's really about the small sizes of the population that they're looking at, but also the large age ranges and sort of a growth measure of skills. It's not really looking at things at the detail that we're doing these days, which is great. So looking forward to seeing some of the things that are coming out. And often the eligibility criteria also is too broad to really explain what it is that's going on. But some of the studies that I've had a little look at, if you can see there's quite a few comments about speech and language separately. So there's 6 out of the 20 children who were assessed in this study, which was a preschool study. And this study itself actually went up to the age of 6. They've found that even the children who didn't have any non-verbal cognitive issues, there were actually quite a lot of children who had speech and language difficulty specifically, and only 1 out of the 20 of those children was eligible for an ADHD diagnosis, but there's obviously a lot more reported in the literature, which you've heard about. So these difficulties in and of themselves actually really can present quite a lot in NF. 16% of these children also had a voice disorder, so moving more to the physical movement of speech. And the general population really only has about 6 to 9%. There's not great data out there about the actual how many people have voice disorders, but certainly it's a much higher proportion with children with NF. 42% had resonance issues, with VPI documented in 7 children. Now we'll go on to talk about what VPI is in a little while. This was a nice study which looked at 62 subjects who were adults and children. They did exclude children under the age of 7, and they excluded anyone with brain tumours or anyone with facial plexiform neurofibromas. And the findings there really highlighted again nasal voice. Interestingly, I don't know about this finding, but deviant S and R, I think that's also just talking about their articulation difficulties more than anything. Pitch regulation, disfluency, and disfluency being more about sequencing and motor planning than a typical true stutter that we often would be seeing in the general population as well. And speech being loud and fast. All of these things to me are kind of highlighting the fact that actually it's about the control of the speech itself, which is something we don't often see in the typical population as well. So children with speech and language disorders or delays don't tend to have this kind of presentation. And I'm interested to know whether or not some of this is about just control of movement or if it actually goes to higher level planning, attention type of difficulties that are overloading some of these inner real speech difficulties at the core. Oh, lost a button, sorry. There we go. Okay. So some of these motor control and planning and organising your talking and to make it nice and smooth, one of the factors of this is actually about how your palate works. So there was a study that has looked at velopharyngeal insufficiency, which is a big, long word, but all it talks about is how the palate moves at the back of the mouth. I've got a few slides that will talk about that next. Effectively, it's just talking about how much air is leaking through your nose during speech. And that sometimes can sound really hard to understand because you can't actually get the pressure in the mouth that you need to be able to make the speech sounds. And it's amazing how just such a small muscle, when it's not working well and timed well, can make speech so difficult to understand. So it's something that we like to make sure we're assessing because there actually are sometimes treatment plans that can make a really big difference to speech clarity. In this study, where they've obviously found in previous studies that this is a feature sometimes with NF1, there's actually also some more recent work going on up at Sydney. I believe there's a speech pathologist up at the Westmead Hospital who's looking into this further, and he's been working in the clinic where he's found about 10% of the children out of the ones he's noticed have actually had difficulties with their palate movement as well for children with NF. It can actually be a diagnostic sign. So we have had children who've come through our clinic, separate to the NF clinic, just into speech pathology, where they have had that as one of their primary features along their childhood, and then it's later become a diagnosis of NF. So it is something that we would like to make sure we're picking up on. The assessment, and that's where we become involved. So if there's a concern about nasal speech, there's a referral that gets put into speech pathology. And where we do a nasendoscopy. This study used MRI as well, which would be amazing, but we're not quite there yet. So we continue to use a scope in the nose to have a little look, which not all children love, surprisingly. But that can often highlight really what is going on at the back there that we just can't see. What has been found, particularly with NF, is that the palate is moving not symmetrically. So it's coming up and often going to one side rather than being both sides moving up as strong as the other. And as I said, there are possibilities for intervention. There are some surgical procedures that could be done to manage this, and that's where our team become heavily involved with plastic surgery team to make sure we're getting the right diagnosis and looking at the right treatment plan. So going back to VPI, all sounds are needing the palate to work. And you can have a play around when you get home, I'm sure, or even in your seats just now, with different sounds to understand that actually when you make the sound p and b, it's really hard to do if you close your nose off. It's probably something people haven't thought of before, and that's absolutely okay, but it is important. It is dependent on muscles working really, really well, and it also has an impact on how well you can swallow, because you can also have food and fluid coming through your nose if your palate's not closing very well. So some of those things where if the speech doesn't sound particularly clear or it sounds like they've got a cold, sometimes is a bit of a sign, but also if they're having food and fluid coming through their nose while eating and drinking. So if that's the case, then have a chat to your doctor. So really, in summary, there is limited research out there at this stage, but hopefully there will be more in the future. There are many ways that communication can be affected, and that's where it gets very tricky, and making sure you have a speech pathologist to assist you in making some of the assessments and determining what is necessary for the future. We know that there is a higher incidence of communication deficits in NF1 particularly, and that some of these are related to different factors. and it could be a combination of more than one factor. If your child is attending the clinic here, then feel free to have a conversation with the team and to see if there's any benefit to having a speech pathology assessment. The neuropsychologist in the first instance will be able to give a good baseline profile and work out whether or not the speech pathology is required, and that will be helpful. If there are concerns with eating and drinking, then it'd be good for us to have a bit of a look at what's going on. And if there is some thought that actually an instrumental, so a bit of a scope in the nose assessment might be useful, we can have a look at that too. But otherwise, local facilities will be able to do that. So hopefully moving forward, there'll be lots more we can talk about in the future, but that's probably all we need to talk about right now. Thanks.
We've got time then for 2 questions, just quickly.